What is onchocerciasis? Onchocerciasis, also known as river blindness, is a neglected tropical disease. It is called river blindness because the black flies that transmit the disease often breed near rivers. This disease affects millions of people globally, mainly in Africa. Onchocerciasis is a leading cause of preventable blindness. It causes a significant burden on individuals, families, and communities. Onchocerciasis is caused by a parasitic worm called Onchocerca volvulus. This worm lives inside the human body and can survive for many years. The disease is spread through the bites of infected black flies. These flies breed in fast-flowing rivers and streams, primarily in remote villages. The impact of onchocerciasis extends beyond physical suffering. It traps individuals and communities in a cycle of poverty. The disease hinders economic productivity and limits educational opportunities. It is crucial to understand this disease to effectively combat it and alleviate the suffering it causes. Causes and transmission of onchocerciasis. Onchocerciasis is caused by the parasitic worm Onchocerca volvulus. This worm has a complex life cycle that involves both humans and black flies. Understanding this cycle is key to understanding how the disease spreads. The transmission cycle begins when an infected black fly bites a human. The fly carries larval worms, known as microfilaria, in its saliva. When the fly bites, it injects these microfilaria into the human's bloodstream. These microfilaria migrate through the body and mature into adult worms. The adult worms live in nodules under the skin. These nodules can be painful and disfiguring. The female worms produce thousands of microfilaria that spread throughout the body. These microfilaria can live in the body for up to 2 years. They cause various health problems, including blindness. When a black fly bites an infected person, it ingests the microfilariae. These microfilaria develop into larvae within the fly. The fly then bites another person, continuing the cycle of transmission. Breaking this cycle is crucial for controlling and eliminating onchocerciasis. Recognizing the symptoms. The symptoms of onchocerciasis can vary depending on the severity of the infection and how long a person has been infected. Some people may not experience any symptoms for years, while others develop debilitating conditions. One of the most common symptoms is intense itching. This itching is caused by the microfilaria moving through the skin. It can be so severe that it disrupts sleep and daily activities. Skin changes are also common in onchocerciasis. The skin may become thickened, depigmented, or develop a leopard-like appearance. Nodules, which are firm, movable lumps under the skin, may also develop. These nodules contain the adult worms. The most severe symptom of onchocerciasis is blindness. This occurs when the microfilaria invade the eye. They cause inflammation and damage to the optic nerve, leading to vision loss and eventually blindness. Treatment and management of onchocerciasis. The good news is that onchocerciasis is treatable. Early detection and treatment are crucial to prevent blindness and other complications. The primary drug used to treat onchocerciasis is ivermectin. Ivermectin is effective in killing the microfilariae that cause most of the symptoms of onchocerciasis. It does not kill the adult worms, but it prevents them from producing more microfilaria. Ivermectin is typically given once or twice a year. It is distributed through mass drug administration programs in endemic areas. In addition to ivermectin, a drug called doxycycline can be used to treat onchocerciasis. Doxycycline kills a type of bacteria that lives inside the Onchocerca volvulus worm. This weakens the worm and can eventually kill it. Doxycycline is typically given as a daily dose for 6 weeks. Surgery may be necessary to remove nodules, especially if they are causing pain or disfigurement. However, surgery does not cure the infection and must be combined with drug treatment.